All right, Ethan. He served in the New York State Assembly from 2006 to 2011. He's a current Dutchesss County executive, lives in Red Hook, New York. We're talking to Mark Molinaro. Hey, Mark.
Hey, Mark.
Good morning. Glad to be with you.
Yeah, it's awesome to have you. So we appreciate you coming on. On February 4th, LoHUD published an article where they say you called the vaccine distribution process a chaotic mess and said the state is using counties as vending machines. Are those accurate quotes from LoHUD?
That's an accurate quote and true. I mean, I don't know. I think actually in some ways I was being a little bit too kind. I think anyone who's tried to navigate the current system to get a vaccine, I mean, certainly there are now millions of New Yorkers who thankfully have gotten vaccinated, but getting through the process is just too complicated. It's very chaotic, and it's just outrageously frustrating. And frankly, you know, as I said, the counties are being used as sort of vaccine vending machines. We have established vaccine distribution plans. In fact, New York State mandates counties develop those plans as part of the State Department of Health response to a pandemic. Every year we update them. As late as last October, we were asked counties across New York to update those plans for what we thought would be execution of them in December and January this year. And instead, the state just shelved them and went forward with a process that has, really limited access. But more importantly than that, and that's a challenge in itself because of certainly supply versus demand. But it's just outrageously frustrating, and it really has caused such unnecessary stress and chaos.
So they told you have to come up with a plan. Each county has to come up with a plan. You came up with the plan, and then they said, scrap that. This is our plan.
Yeah, worse than that. I mean, we are, county health departments are the local health department. You might go to some other state and the local health department is run by the state of Florida, the state of Virginia. In New York, the local health department and the arm of the state health department is run by counties. In fact, now 1,900 counties across America administer the state health departments, and of course, all of them in New York do. We, a decade ago, were asked to develop these plans. We've trained on them. In fact, my very first year as county executive in 2012, we did our first full life real-time exercise in pandemic response. We actually played out a vaccine distribution location and a recovery unit. So communities, counties have been developing these and fine-tuning them for a decade. And the interesting thing is, the state of New York, as part of that plan, requires us to work with local pharmacies, local physicians, residents, community groups, and ensure that there's an equitable distribution of vaccines. That's our job. And for whatever reason, the state just simply shelved those plans.
Let me ask you: is there one individual or group of individuals who's to blame for this?
Oh, it's Governor Cuomo. I mean, I don't want it to be. Listen, I know that somebody might listen and say, "Oh, sure, he thinks that." No, the governor was given extraordinary powers a year ago. The state legislature gave him that. He's written some 250, in quotes, laws, orders that act as the law or the function of law. He made the choice. He made this choice, and we can't say we know why. Early in the pandemic, the concept of centralizing decision making makes sense. You get, at a fire, the fire chief and team assesses the location, controls and commands the situation. But as the fire rages on, you call in other companies. You call in mutual aid, right? And then sooner or later, your field lieutenants and those guys in the building are ladies in the building, starting to make decisions. This governor never relinquished any of that. So we are still in a situation where they make all the choices. And you just can't appreciate the on-the-ground decisions that need to get made, the inside-the-burning building decisions that get made if you're on the second floor of the state capitol. It's just not going to happen. And so this was that moment, at the very least, county's been saying this for months now, but as you began the recovery, the rebuilding, and the vaccine distribution, that was the moment to flip the switch and start empowering your local partners to really be on the ground. Not to mention, we have thousands upon thousands of public health professionals who have trained their lives for this moment, who have seen thousands and thousands of lives taken from us and families ripped apart because of the virus. This was their, and I hate to make it sort of personal for them, but this was their inspiring moment to bring light, to bring hope, to bring solution. And it's been sidelined. It'd be like kind of playing, I don't know, a football game like the Super Bowl and keeping Tom Brady on the bench.
Right.
Wow.
Dutchess County Executive Mark Molinaro joining the show. And forgive me if I get this wrong because we're just getting to know you here on the Ethan and Lou Show. You said Cuomo's to blame. Did you serve on his mandate relief redesign team? And what is that?
Now, it's a fine question. It turned out to be absolutely nothing. I was asked to represent the Assembly minority on the governor's mandate relief team. I actually served on this governor's transition team when he was first elected, and like many people, had a great amount of hope. In fact, now remember he spoke to the New York State conservatives and said, "Listen, I'm a conservative guy." So he certainly has evolved over the years. That mandate relief team actually, and interestingly enough, is exactly what we're talking about with vaccine distribution plans. New York State forces more of its state policies onto the backs of local governments than any state in America. As I said, if you were in Florida or Virginia, the health department is a state agency that functions locally. Education is basically funded universally through state revenue. I mean, go down the list. In fact, even street maintenance in most counties in Virginia are state run. In New York, they expect counties to do those things. And so 70% of Dutchess County's $500 million budget is entirely dictated by Albany. We've been talking about this for years. And that relief, when he came into office, was this concept of trying to look at those mandates, peel them back in the hopes that we can drive down costs to local property taxpayers. And it went nowhere. I mean, it went nowhere. And any of us who served, we all feel the same. It was sort of a wasted moment and a lot of time taken that didn't produce anything. But again, those mandates, that order, if you will, that 70%, within that 70% mandated expense, Dutchess County, Chautauqua County, Suffolk County, all have to develop these vaccine distribution plans as part of our mandated public health responsibility.
There are a lot of conspiracy theories around COVID-19 and the vaccine distribution. Don't you think when the state steps in where the county is supposed to be the structure for the process and the state says, no, we're going to do it, doesn't that feed into the conspiracy theories?
It does. At the very least, well, let me say this. At the very least, it erodes confidence. But remember, you had this governor saying he wouldn't trust the vaccine under President Trump's administration. Just saying those words set at least a percentage of the public into a tailspin, and then suggested that the state of New York had some panel that reviewed this, by the way, instantly. I mean, it was like the same night the FDA approved the use of the Pfizer and Moderna shots. Apparently there was a panel that no one's ever seen, no one's ever talked to, and I would bet you there isn't more than a handful of people in the entire state of New York who know those people, who know who they are or that it happened. And so that in and of itself, because he wielded the microphone and the podium and the television, set us back. But you're right. You're absolutely right that the concept of taking it away from the local faces, because again, this isn't a county plan, a county-owned plan, right? It's not Dutchess County's government's vaccine plan. It is the local health department's vaccine plan. We are required to have partners in the federal qualified healthcare clinics. We work with doctors and physicians. We have to work with pharmacies. We would have a distribution structure that puts you and someone you trust in the position of helping you choose to be vaccinated. That's critical. The other is if you made a phone call to us, we'd be able to say that the pharmacy on Raymond Avenue in Poughkeepsie has vaccines, or the healthcare clinic out in Amelia has vaccines. We aren't able to do any of that. So in the end of the day, the public doesn't know who's responsible, and therefore, rightfully, holds everyone responsible.
One more for you, because we know you're a busy guy. What we keep hearing from, we're in Danbury, Connecticut, which I don't know if how much you know about us. We're in Danbury, Connecticut, but we're right on the state line. We have a lot of New York listeners, but we keep hearing from other leadership is that there is a big question about how many of the doses are actually being delivered. So you keep hearing about people going to get a vaccine being turned away and sent home. Is that a big problem, and how could that be fixed?
Well, I mean, again, you know, knowing we can't turn back time, you would have started with the local plans, because then we would monitor and be very transparent in what we get, what's being delivered, and we'd explain it. In New York, you shouldn't walk up to any place, right? If you're trying to get the vaccine, you really are supposed to contact that provider, pharmacy, doctor's office, in some cases, county health departments, and schedule your appointments if you can. Now, that's very, as I said, very complicated, and there's huge demand for limited supply. But to your point, yes, the answer is that we aren't given consistent and transparent data to explain to the public where vaccines are at any given time and what the total distribution is. I can tell you once a week what doses exist in Dutchess County. The county government this week is getting 1,200 doses to administer, by the way, to 125,000 qualified residents. Just keep that in mind, 1,200 doses. I can tell you that there are a dozen pharmacies that are each getting 100 doses, but I can't coordinate all of it because I'm not permitted to, and therefore you have to kind of hunt and peck. We kind of sadly joke that it's like chasing a unicorn. Not that many people catch one, and so not having that complete data is really a challenge, and it erodes trust and confidence and creates this unnecessary chaos. And I just would say, I know you want me to wrap up. This governor asked of the federal government more data, more detail, and more flexibility to administer the doses. Ironically, that is exactly what we're saying to the governor. Counties across New York are just saying, instead of cannibalizing the distribution and taking thousands upon thousands of doses and sending them only to state regional sites, give some percentage back to the county health departments so that we can more adequately and equitably distribute vaccines. Give us the demographic data so that I can tell you in the, you pick 12533 zip code, how many, what percentage have gotten the vaccine, what the demographic breakdown is, and then I can focus resources. I can have people reaching out into senior centers, into community spaces and community organizations that would help drive folks to a location. That is the way you would do this, and it's just sadly been eroded. That confidence has been eroded, and hopefully we can regain our footing, and the public will weather the frustration. But it is. I mean, I can only tell you our staff and the folks, we're doing thousands upon thousands of emails and calls a day, basically telling people we wish we could help. We're just handcuffed, and it's unfortunate.
Dutchess County Executive Mark Molinaro, we really appreciate your time. Thanks for reaching out to the Ethan and Lou Show.
Thank you much.
Be safe. Thank you.
All right. Bye-bye.